Of Longevanity, the intersection of longevity and looking and feeling your best. I'm just waiting for all of our streaming software to go live, and then we will dive into the day. I think we're there now. Perfect. So let me just close this little window here, and then we can carry on. I can take these off because now I don't need to see everything. So welcome to another episode today. My name is Amber Bochnek. I'm a physician who I have a blended practice between inside and outside anti-aging and longevity for best health span. So before we dive in, a really important place to start is just to remind everybody this is for discussion and educational benefit only. Nothing we talk about here is meant to be personal medical advice. And most importantly, if you hear something here that resonates with you and you'd like to pursue it, I would strongly encourage you to have that chat with your primary care provider, whoever that may be, and just make sure that these things are right for you before you dive in. So with that said, let's dive in ourselves. We're going to talk today. I thought it would be interesting. I've done several conversations in and around health span. Today, I'm going to focus on the outside a little bit. This past week, I've done several live videos with my most recent CO2 laser resurfacing. So if any of you have caught any of that footage from earlier in the week, you will have seen me with my very, very blown up like a beach ball face. I think my favorite analogy is I thought I kind of looked like a cross between a cherry tomato meets waffle iron. So I'm now exactly 1 week plus 1 day out, and I'm mostly back to normal. I'm a little more pink than what I normally am. I don't have any makeup on right now. This is sort of the natural me, and I want to talk about that. So a lot of things that happen over life and time, and a life well lived is if you like being outdoors, or even if you spend a lot of time indoors commuting or other, the UV is out there and there's lots of ultraviolet exposure. And as wonderful as the sun feels with its heat and its warmth and the bright sunshine, with it comes ultraviolet rays. And one of the things that's really important to know is that even when the days are dullest and dreary, or if you're indoors or in your car, the ultraviolet light is coming through regardless. And so it's the ultraviolet spectrum that causes the problems with the skin. Ultraviolet does a host of bad things. It damages the collagen and the elastin in your skin. What can mutate some of the DNA that you have, the genetic material, which can give rise to skin cancers. It causes photoaging and pigment spots. Any of you who are my vintage, who maybe were teens back in the 80s before we wore a lot of sunscreen, may have done what I did, which was wear a lot of baby oil back in those days. We were cool, we were tanned, but it was not good for us. So there's ramifications of all of that. So this is where we look at options to try to deal with that. So what I want to talk about today in light of my recent resurfacing, which is probably one of my more aggressive treatments to deal with these pigments, is really look at sun-induced skin damage and what can you do to have the best skin for life. And I think it's a fitting day to talk about it. It's actually a nice, warm, bright spring day out there, a little inkling, hopefully, of what's to come. And it's an important time to kind of talk about these things. So as the days get longer, our potential for light exposure is there, and it becomes increasingly important to do something about it. So first line of defense, not glamorous, not sexy, but important and effective, is sunscreen. The best sunscreen out there is the one that you're actually going to put on. And I know that may sound a little, silly or sassy. It's not meant to be. It's actually honest. So it doesn't matter how wonderful it says it is on the label. If it is something that is not practical for you to use, or if it's too thick or too cakey or too anything, too ... fill in the blank, it's not the right sunscreen for you. So really what we want to do is try to find one first and foremost that you will actually put on. Now there are different ways to do this. So sometimes if you enjoy using a specific moisturizer, take a look at the packaging. It may actually have a broad spectrum SPF that's already in it. And so this is what we're looking for, something that covers a lot of the UVA and the UVB. You want to get good broad spectrum coverage. In the perfect world, around about approximately an SPF of 30 would be ideal. So again, if you're close to that, close counts, again, close, and using it every day is better than that which you don't. So we start where you're at. So again, if you have a moisturizer that has it built in, or maybe again, you're like a fresh face to the world, you don't have a multi-step program in the morning, maybe you just look for a practical little sunscreen, you just slap on there once you get out of the shower. But no matter how you cut it, it's really important to do. So sunscreens come in different forms. There are chemical sunscreens, there are physical sunscreens. Physical sunscreens usually contain zinc or titanium, and then the chemical ones, of course, have different agents that are in them. You want to look for something in your sunscreen that doesn't contain a lot of smells or scents. We're really trying to steer away from scented products these days. A lot of scented products have what we call endocrine disruptors. The smelly stuff, no matter how pretty it is, sometimes that smelly component of it actually has agents in them that behave like estrogens, but not the good kind, the naughty kind. So you want to stay away from extra scents and extra colors and things like that if you can, other than the ones that are appropriately tinted. So again, a clean sunscreen, a physical defense might be a little better for most people unless it feels too heavy, but they've come up with better and better ways to apply those zincs so you don't look like a white-faced mime. And something that you can wear every day would be ideal. And if you can incorporate that into your everyday regimen, that would be best because again, the UV portion, if the sun is up, it doesn't matter if it's January. It doesn't matter if it's cloudy or raining. Doesn't matter if you're inside your car, if the light is striking you, or if the sun is up, it's coming, the UV is coming through. So every day, all the time, 365 days a year. So that would probably be best approach. So besides sunscreen, other things you can do for your body, there's a lot of sun-resistant clothing that's out there. So again, if you've got little kids and it's a fight to get the sunscreen on them, sometimes you can just get those little sun shirts and sun hats and bathing suits that have that all built in. Makes it much, much easier. Sitting under an umbrella, staying in the shade, second line of defense. Again, first we want to make sure we have that sunscreen on because some sun does get through. So those are some real fundamental things to really consider as part of your daily routine to try to stop that from happening. Next, then we start to look maybe at what to do a bit about it once it's happened. So for me, you know, the horse is out of the barn, so to speak. Again, I took lots of sun back in the 80s. And again, those are things I would not do now. Like again, we used to go get a base tan before we went on a sunny vacation. The whole goal of my vacations in Florida or Mexico back in the day were to try to come back as brown as I can, or at summer camp on canoe trips. We would all be laying out in these aluminum canoes trying to get as tanned as we could while we were out in the woods. Today, again, a very different approach, but nonetheless, all those years have caused a fair bit of photo aging. So this past week, I actually elected to do the big gun. I pulled out the CO2 laser, and we'll talk about some different approaches to that to try to deal with my pigment because it's very resistant. So before going all the way to CO2, there are a number of different things that can sometimes be helpful to address pigment. So first and foremost, as we've just finished talking about, prevention. So sunscreens, hats, sun shirts. If you're a big commuter and you're always getting that sun on the east on your way in and the west on the way home, then you may even want to consider a proper UV filter for your car windows so that it helps, again, to keep less of it on you. From there, sometimes we can use just simple topical things. There are some things that are out there that are proven to be helpful in reducing and cleaning up pigment. So topical agents, this is again to be done under the advice of your primary care provider because some of these things are a little bit irritating. Straight up, topical vitamin C. Topical vitamin C is a collagen stimulant. It has a lot of antioxidants in it primarily, and it helps to scavenge free radicals, which are chemical byproducts that are very reactive, but not in a positive way. They can cause a fair bit of damage. So vitamin C helps to combat that, and it can also help to fade some of the skin and some of the pigment. With that, or on its own, we can also look at retin A. Retin A is a vitamin A derivative, actually. It's interesting. We've got vitamin C, vitamin A. Retin A you have to be careful with. It comes under many different brand names. Retin A does have a reputation, and it's real, of being irritating. So this is definitely one of those things, if you're going to try it, you need to do it under the guidance of your care provider. And it is truly a less is more situation. So slow and steady. What might that look like? Well, one way that can be done is that sometimes you start just simply applying a very thin amount once, maybe twice a week with some moisturizing cream over top. And you do that for a couple of weeks. And if you're not having a lot of like chapping of your skin, it's not getting red and irritated or flaking, it means most likely that you're tolerating it. And then you can go up to, again, 2 or 3 times a week. Now, if you get a bit of irritation from that and the skin is now getting red and irritated and flaky, it means you have to back off a little bit. You ease back, let that settle. Once that's settled, you try again. And it's sort of this on and off until you develop tolerance. That's how you do it. It's really a little bit of trial and error and recognizing when the skin is starting to get inflamed and backing up a bit. Progressively, slowly over time and on your own tolerance, eventually you may get to once a day, every day. But again, everybody will be a little different in that regard. And there are also different strengths and potencies. So usually you kind of start from the bottom up. Just do a little bit at a time and gradually increase as you tolerate it. So these are some good things just to help deal with pigment. There are also some various plant extracts that can be helpful, again, to try to suppress some of the melanin production. In days past, we used some more potent medications that contained a substance called hydroquinone, but that is kind of coming into a little bit of scrutiny because there's definite concern that it may cause actually some harmful effects. So that is not widely used anymore. So if you've heard about it, again, that's something that requires a definite conversation about it because we do have some concerns. So from there, when we look at some of just the skincare items, we can start to move and advance into some of the different procedures. And there are a couple of different things people try. So microdermabrasion and light chemical peels are things we can do to exfoliate the skin, get the top layers off. Indirectly, they help a little bit with pigment in that they tend to remove the top dead layers of the skin so that your topical agents apply and absorb better. They, on their own, may be slightly suppressive of the pigment, but usually they need to be done in combination with topical agents in order to try to get best effect. If something a little more intense needs to be entertained, or if the timelines are shorter and you're looking for more productivity more quickly, then we start to get into the realm of the energy devices. So one of the options, and there's a couple of here, one of them is something called IPL or BBL or photofacial, a number of different names. But basically that's using broad spectrum light and it's being absorbed by the problem pigments. So the light gets converted into heat and the heat actually cooks the pigment and that helps to make it sort of flake off over a course of about 7 to 10 days. It's really a very interesting phenomena, laser and light physics. I kind of like it. I don't know if any of you are old enough to remember the Easy Bake Oven when you were a kid, or maybe you saw it with your children now. They did make a resurgence, but Easy Bake Oven was a really popular child's toy back in the 70s. And this was a little oven for kids to use to make like cake mixes and stuff like that. But it was powered simply by a light bulb. And that light bulb made enough heat that you could actually cook a cake all the way through. So the Easy Bake Oven is one of my favorite analogies when I talk to people about laser. So again, similar to the Easy Bake Oven, it's light to make heat to cook, which is what we're basically doing in most laser procedures, or the common ones, like for blood vessels, pigment, hair removal. Easy Bake Oven, light, heat, cook. The big difference between the child's toy and the very sophisticated laser is actually the ability not to cook everything. Because if you cook everything on a human body, you have effectively burned them. So the magic is not in the cooking. Even a child's toy can do that. The magic is actually in being very selective. How do we selectively cook some things but not cook everything? And this is where the wavelengths, the color of the light is very, very important. So the light colors that we use when we're treating pigments, whether that be in facial spots or hair removal or blood vessels, are very tuned in to where the color of those targets actually absorb really well. So they get super, super hot. And the reason that happens, again, being a girl who loves analogies, my next favorite analogy is in regards to the sunshine. So imagine now, fast forward to summer. It's the hottest day on record. You're outside, you got bare feet, and you can either stand on your white concrete sidewalk or you can stand on the black roadway. I think most of us, or at least I, would be on the white concrete sidewalk. Why? Well, of course, the white sidewalk is way cooler. Why would I stand on the black asphalt and burn my feet off? Well, here we tie this back into the laser and light principles. The sun shines equally on that white sidewalk as it does on the black asphalt, right? Same sunshine on two different substances. But the substances absorb the light differently. So the white sidewalk doesn't really absorb very well. It's more reflective. It's not really absorbing. And so it stays much cooler than that black asphalt, which is absorbing it powerfully and is way hotter. So this is how light interacts with the skin. We use very specific selective wavelengths that we know are more absorbed by pigment or more absorbed by blood vessels. And when we do that, we can take advantage of those properties to try to hit the darker pigment and leave the regular skin alone that's lighter in color, whether that's a blood vessel, a pigment, a hair, but that's basically how these things work. So the more contrast in color between the pigment spot, the blood vessel, the hair, to the skin, the easier it is for the laser to target and selectively heat those areas, and most importantly, leave the other skin alone and not injure it. So this is how lasers and light work. So taking this back now to photofacial, when you have a lot of sun-induced damage and the spots are really dark and the skin is fairly light, or there's a lot of contrast in the color between the problem spot and the background skin, it's actually much easier for the laser to selectively heat it and improve it. As you do these treatments, because not 100% of it goes away in one sitting, usually a reasonable expectation would be maybe a third, best case scenario, half is reduced with each treatment. You need to go back for another treatment, but now you've got less pigment and it's closer to the background skin color. So that combo makes it a little harder. One, it's harder to hit the target because now you're transitioning more. If we go to our analogy, you're a little less like asphalt and a little more like the sidewalk. But also, too, the background color of the skin is now closer to the target, which makes it a little higher risk. So you need a little more energy and you got to be careful about it. So it's like a little bit of a double whammy. So it becomes a progressive, challenging thing. And ultimately, if you think about how it doesn't get all of it, it gets some of it, as we continue to progress it and make these things better and better, in essence, we're making the job harder and harder. So at a certain point, it becomes not effective enough to make further treatments warranted, and at the same time, it's increasing the risk. So that's usually where most people call it quits on things like IPL, photofacial, BBL, and they leave things be. The other reason to do that is these types of treatments, these laser treatments or light-based treatments, they don't actually cure the problem. And this is a big take-home message of today. If you've acquired photo damage or pigment, short of having a magical time machine and going back in time and not having that exposure, there is no way as it stands in today's time and tech to actually cure it or get rid of it. We don't. Plain old, we don't. These things are remission tools. They make it better, but they don't cure it. And so just as life happens and we go outside and we get exposure, the pigment's going to come back. So this is something like maintenance. It's like cutting the grass. You don't cut the grass expecting never to cut the grass again. You cut the grass, make the lawn nice, knowing that it's going to grow and you're going to have to cut the grass again. So the same with the pigment. We treat the pigment. We may do photofacial, IPL, BBL, anywhere from 1 to 3 times at a certain time frame. Try to clean it up a fair bit. You're going to go back out and enjoy life. And when that happens, you'll do your best with your sunscreens and your hat and your protective things. But nobody, unless you're a vampire, is completely protected at all from, completely from the sun. And it is going to come back, and then we retreat. It's a maintenance thing. So it's very important to know, no matter what you do, this is something that does require maintenance. Now, in many people, photofacial is quite effective. I would say in the population we get quite good results in about 80 to 85% of the population. The other 15-20%, I'm in that category, we don't really respond as well to it. So maybe a little improvement, maybe not very much. And then we look at more aggressive things. And this is where enter the CO2 laser. So the CO2 laser is also a laser, but this laser is a little bit different. It doesn't actually see or heat pigment. It actually is attracted to water in the skin. So this device or this laser is different than the IPL in that it actually vaporizes the water. And by vaporize, I mean put it up in smoke. When the CO2 laser light hits the skin, it is so powerfully absorbed that it immediately brings that little bit of tissue to the boiling point, like literally, and it makes a smoke plume. So it just heats it up and crisps it right up and away. So the way we do this now, again, kind of going back to my grass analogy, if you think of your face as being your front lawn, we aerate the lawn. So we use the CO2 laser with all of it makes little perforations, and that helps to clear up the skin. Now, we don't take all of it off because that would be like ripping all the sod off, and that would make for a very nasty looking front yard. And it would mean in the face a really long recovery. So we only do it in an aerating the lawn way, which means we don't actually cover all the tissue because we don't want to do that. That would make a very big wound that would be hard to heal and have much higher infection risks. We just aerate, or we make little holes. So we get a chunk or a percentage of it, but we have to go back and repeat it. Similar to the less downtime one, it's not curative. And so even with these more advanced aggressive treatments, we still need to sun protect. And even so, again, unless you opt for a vampire's life, which I don't recommend, it is going to come back, and it's a maintenance problem over time. The big difference with the CO2, a couple of big differences, is that CO2 definitely can strip the pigment better for most people than the IPL can, more effectively. It also can help more with textural problems, which again isn't really the mandate of IPL. IPL is a great tool for color problems, but color plus fine lines and crepiness, the little bonus with CO2 is the CO2 is a resurfacing or an ablative laser, a cutting laser. So we tend to find that it has a little bit better effect on tissue quality, skin texture. So you get a 2-for-1. You get some improvements in your fine lines and also improvements in your pigment. However, there's always trade-offs in life, and the trade-offs are the downtime. With IPL, the first type of light and laser we spoke to, there's very little downtime. So again, you can put makeup on right away. You can go out and into your day without a lot of social disturbance. Sometimes a few people get some swelling for 3 or 4 days, but the majority of people can kind of pull it off and they can pass. When it comes to CO2, there's no makeup and there's no passing. So for a good solid 5 days, the skin is open. You are red, swollen, and glistening with Vaseline. It's like having a great big scrape all over your face, and you have to keep it moist. So you can't put makeup on it. And it does cause quite a bit of swelling. I do have some little videos on my Instagram feed. I did them day by day because I think it's really important to plan for this social downtime. So it's not that we can't do it, but we have to do it in a very planned way because it's real. It's very effective though. So I've just done 1. I'll probably need to do again about 2, maybe a 3rd. But I'm already significantly better. I still have a little bit of redness here. I just did this, again, a week plus a day ago. So if anyone has been following me on socials, you'll know I kind of look a little more like myself today. Again, my pigment is considerably better than where I was previously. I still have a little bit of redness, but it's not 100% gone. I would say probably I'm reduced by about 60%, maybe 70. And then again, just some of my little fine lines. I hit some here in my center cheek because this area is getting a little crepey as I'm in my 50s. And that's a little bit better as well too, but it could use a little more. So I'll give it about a month and then I'll try to get it one more time before it gets sunny because we tend to kind of hold off during sunny season. Sun plus laser, they don't play nice together, so we have to kind of stop over the summer. So anyways, this is sort of our little journey all in and around sun pigment. This is the time of year that we like to laser. So whether it's IPL or it's CO2, if you're considering it, we want to do it in the not full sun months. Usually in our office, we try to get this all buttoned up by about some point in May. So if it's something that's on your radar and you want to talk about it, please do message. Once we cross over into that high sun season, we usually hold off and then pick up again sometime in late September or early October. So thanks so much for watching and being part of our skin care and skin prevention journey. If you only take one message home from all of this today is think about your sunscreen. It's a gift to future you. And again, remember all these things we chat about should always be consulted with your own primary care physician or your nurse practitioner. Just make sure you're doing something under guidance. Thanks again for watching and we'll see you next time. Bye for now.